Welcome to my presentation. My name is Shauntelle-Jane Mothavakatha and my student ID is A002-45973. The topic that I have chosen to discuss on is neurosurgery. And before I continue with my presentation, I am strongly emphasizing that everything that I will be presenting on is based off book knowledge, based off of things that I have learned and studied. So please do not take my presentation as reference and use it in a practical method. Moving on, what is neurosurgery? Neurosurgery is commonly known as the surgery of the brain. Neurosurgery is the surgery of the nervous system. So neurosurgery is also the medical specialty concerned with the surgical treatments of disorders, right, which affect any portion of the nervous system. And this is including the brain, the spinal cord, and the peripheral nervous system. With that being said, can any health profession or medical director perform neurosurgeries? And the answer to that is no. So there are special people that perform neurosurgeries, and these people are called neurosurgeons. And as you can see here by the picture on the right, neurosurgeons look like regular doctors, but in actual fact, they are not. They have years and years of experience, and approximately it takes about 14 to 16 years to become a neurosurgeon. Neurosurgeons undergo one of the longest training periods, of any medical specialty due to the complexity of the medical field, right? So with that being said, I have explained and I have allowed you to become familiar with the term neurosurgery, and I will be diving into one of the most commonly practiced procedures, commonly practiced surgery, that neurosurgeons do, and that is called a craniotomy. So a craniotomy, what is it? A craniotomy is a surgical procedure in which a part of the skull is removed temporarily to expose the brain and perform an intracranial procedure. So why a craniotomy? A craniotomy can be done to remove brain tumor. It can be done to clip or repair a cerebral aneurysm. So a cerebral aneurysm is basically a bulging or weakened area in the wall of an artery in the brain. It can be done to remove hematoma, which is blood clot in the brain. A craniotomy can be done to drain abscess and to repair fractures in the skull. Moving on. So a craniotomy is named by the bone that is being removed. So this is a brain. This is the back part of your brain. To the very back, if that part of the brain is being removed, it will be called a suboccipital craniotomy. If the midsection of your brain is being removed, that will be called a temporal craniotomy. And towards the front, if that part is being removed, that will be called a parietal craniotomy. And to the very, very front, that is called a frontotemporal craniotomy. So what happens during a craniotomy surgery? There are 6 main steps during a craniotomy, and the procedure can take up to 3 to 5 hours or longer. But this is solely depending on the underlying problem, right? The underlying problem being treated and the complexity of the problem. So step 1, which is preparing the patient. So patients are admitted on the morning of the craniotomy, and with an IV line placed in their arm, general anesthesia is administered while they lie on the operating table. So for those of you who do not know what IV is, it is an intravenous line. And a general anesthesia, I am sure that you have seen them in movies when patients are going in for an operation. As they lay on that operating table, all of a sudden they just fall unconscious, and that is administered by general anesthesia. Moving on, step 2, which is making the skin incision. So after the skull is prepped with an antiseptic, as you can see here, the skull is basically covered with an antiseptic. A skin incision is made, and that is usually behind the hairline. So in most cases, as I have mentioned earlier about craniotomies being named for the different bones, right? So according to the section of the brain that the craniotomy is being done, there is a high chance of that part being the hair being shaved off it, or in most cases they shave your whole head off, and this is just to avoid any complications and to avoid contamination, right? Avoiding hair like just going into the opened area of your brain, which is very, very unhygienic and may cause further complications. And so here we go, moving on to step 3, which is performing the craniotomy. So the skin and muscles are lifted off the bone and folded back, as you can see here, the first diagram that is on the left. And one or more small burr holes are made in the skull with a drill. Here in the picture in the middle, so you see that that equipment machine looking thing, that is called a drill, and the holes that it is making is called burr holes. And lastly, inserting a special saw through the burr holes, the surgeon uses this craniotome to cut the outline of the bone flap, as you can see here in the final image on your right. And step 4 is exposing the brain. So after opening the dura with surgical scissors, the surgeon folds it back to expose the brain. So if you do not know what a dura is that flap that covers the brain, and it is inside. So that is the skull. Then once you cut open the skull, you see the dura. Then you have to cut open the dura. Then you will be able to have access to the brain. So retractors are placed on the brain gently, opening a corridor to the area needing repair or removal. Step 5 is correcting the problem. So surgeons will use their special tools to get inside of the brain to remove the problem. And as I have mentioned in the first few slides, whether the problem be a brain tumor, meningitis, blood clots, and so on, hematoma, cerebral aneurysm, and all that I have mentioned, right? So a few of these special tools that surgeons use, as you can see here on the left, this is not just some regular goggles. These are called loops. And as you can see, it has a special feature in front of the goggles, and that is the eye lens. So that is just to allow surgeons to see the problem more clearer, right? And here, secondly, you have a long-handed surgical scissors. And lastly, you have a computer-controlled image-guided surgery. So this is to help surgeons see what the naked eye cannot see, right? See beyond what the naked eye cannot see. And step 6 is to close the craniotomy. So with the problem removed or repaired, the retractors that are holding the brain are removed and the dura is closed with sutures. So an interesting fact, even though sutures may look so easy and look so small, they actually play a very, very important role, and it takes a lot of patience and a lot of experience to master the perfect suture. And if you have time, please do read on the different types of sutures. I can assure you that you will be blown away. So lastly, the bone flap is replaced back into its original position, and it is secured to the skull, as you can see here on the far right. It is secured to the skull with titanium plates and screws. So what happens after the craniotomy? So after the surgery, it is expected that patients feel lightheaded, patients feel a lot of pain. And to manage this, they are prescribed with narcotic medicine, and simply narcotic medicine are pain relievers. So it is highly encouraged that narcotic medicine only be prescribed for pain, for very, very severe pain. Yeah, not tiny pain, but very severe pain. And a medicine may be also prescribed to temporarily avoid seizures, as seizures are one of the risks of a craniotomy. So what are the risks of a craniotomy? So just like any other surgery, any other procedure, there are risks. There are always risks to any procedure being performed. But for a craniotomy, there is a chance of the patient suffering from stroke after the craniotomy, seizures, the swelling of the brain, and with this, there is a high chance of the patient having a second craniotomy due to the swelling of the brain. Nerve damages and permanent brain damage with associated disabilities, that is paralysis, not being able to talk, not being able to move certain parts of your body. But these are the risks of a craniotomy. But as I have mentioned when I started off with this, there are always risks to any surgery being performed or any procedure. So thank you very much for bearing with me, for listening in on my presentation. I hope that you were able to learn something. And this is the main source that I use as reference to get a majority of the points that I have presented on. And it was an article that was written by the University of Cincinnati. And yes, this is a reference to it. But if you need further references, I am more than glad to share the sources with you. You can email me or you can contact me in any of the social media platforms. Thank you very much for listening in. I hope you enjoyed it and I hope you learned something. Stay blessed. Vinaka.